So I will go ahead and call the Human Service Board meeting to order. By way of roll call, board members present, Barbara Sheldon, Christensen, Ken Borsick, Vicki Krause, myself, Mary Walters, Scott Kempley, Tim Jawazia, and Chuck Warnhoff are absent, and Damaris Tone is also not present, and she may pop on virtually, I'm not sure, so. Next item on the agenda is to review and approve today's agenda. Any additions or corrections? If none, I would entertain a motion for approval.
Second.
All right, motion's been made and seconded to approve today's agenda. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed? Motion carries. Next item is to review and approve the minutes of our September 8th, 2025 meeting. Are there any additions or corrections to those minutes? If not, I would entertain a motion for approval. Okay, motion by Peggy, seconded by Scott to approve the minutes of our September meeting. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed? Motion carries. Citizens inquiries and concerns. I don't see anybody in the room, and we have nobody online either, Jacob. Thank you. Any introductions to the area at all? Okay, thank you. Then we'll move right into Veteran Service Officer report. Chris.
Good morning. Or I should say afternoon. I never know when I'm gonna be sitting in here. Yeah. We've closed 7 cases since last month. We continue to work on 112 others. We have 12 cases at the Board of Veterans Appeals. We had 4 veterans pass away since our last report. For outreach, we had a Patriot Day and a flag disposal ceremony on the 11th of September. We had a veterans funeral on the 17th of September, and then we had the Southwest CVSO training conference on the 26th. Upcoming, we got the Marquette County American Legion meeting. Those happen twice a year. This one's on the 16th of October. The Tribal and County Veteran Service Officer Fall Training Conference is in Eau Claire from the 20th to the 24th. I'll be there for 3 of the 5 days, and then I'll have the office open back up. We had a visit from the acting secretary for the Wisconsin Department of Veterans Affairs, and it was a nice discussion. And he said that the governor is going to pursue trying to get funding for the veterans housing that I spoke of before, where a homeless veteran can get housing, training, counseling, and a place to sleep and eat, you know, as they're getting their lives back together. And all the funding for that was cut. They went from 3 locations to just 1, while they're still pursuing getting funding for the other 2. He said that he congratulated us on doing a good job. That was kind of nice to hear. And hung around, just explained to us what's going on politically with the veterans down there in Madison. That was mostly an update about that. Transportation grant, we notified Jan that's open again. It's not due until the 1st of December, but I'm sure she'll be done long before then. Secretary did tell us that that grant will have a 16% increase from last year. And I explained to him that, yeah, that money's usually used up before the end of 1 month. And he said, really? I said, yeah, it doesn't go very far. But I said, I appreciate any increase you'll give us. Operation Christmas Angel, we get notification from them annually, and it's for needy families and their children. It gets gifts for them. And what the families do is they list clothing sizes and things like that, and the names of their children. And then Operation Christmas Angel will send gifts to the family for Christmas. And we have several families in the county that pursue that program when I notify them of it. And that was all I had, other than VA things, VA services affected by the government shutdown. The programs that were affected were GI Bill hotline. People would use that to call to check on their college payments. Regional benefits offices will be closed. Ours is in Milwaukee. They'll cease public affairs and outreaches to veterans. They'll not place any headstones or maintain grounds at any VA cemeteries. They'll not process applications for pre-need burials, and they will not print any memorial certificates. And those are things that we can get for people, for surviving spouses when the veteran passes away. The good news is veterans' health care will not be affected. Veterans' benefits and claims will continue to be processed as before. There will not be any change, including compensation, pension, education, and housing benefits are all gonna continue. And that was all I have.
I have a question, Chris, about three facilities for the homeless veterans, which is the one that's remaining open? Where is that located?
Union Grove, Milwaukee.
Okay.
Yeah.
Anybody else have any? Yes, Barbara.
That Operation Christmas Angel, is that, who like sponsors that or?
It's just a group of people down by Milwaukee, and they get donations from different organizations around the state for it. And yeah, it's not like Knights of Columbus or something. This is just their own little thing that they started, and they get donations for it so that they can provide that. It's statewide. They send a notification to all the veteran service offices across the state. I have to certify every application that it's a veteran's family. That spreading the information and then certifying that they're a veteran is what I do.
So they focus strictly on veteran families?
Yes.
Any other questions? Thank you, Chris, for your, we appreciate it.
Okay.
Human service reports, moving into the director's report. Wendy.
Happy to announce that we have filled our clinic case manager position. Her name is Kim. She'll be starting at the end of October. We have a therapist vacancy due to one of our therapists leaving. We're trying some paid recruitment options. This position has been hard to fill in the past. So far, we've had like 3 applications. We are working on trying to set an interview with one person. So keep you updated. It's challenging. I think we talked about this before. We're competing with county government and private sector for this position. So we're in the process of testing the AI phone software to implement it and try it for the last couple of months of the year. So that's been kind of interesting and fun, tweaking different things. So once the testing period is done, we'll go live and see how it goes.
Modern technology.
Yeah. And then I guess I was gonna review, I guess it's a little bit of me and probably a little bit of Jen, but we were gonna review kind of where we're at. Obviously, we've made some changes to our proposed 2026 budget because we have budget hearings for the citizen members. We have budget hearings to go on Thursday afternoon in front of exec and finance. So we were gonna talk about some of the changes related to that. So I don't know if you wanna jump into that.
Yeah, go ahead.
Great, so, forgive me, I have multiple versions in front of me, trying to keep track of them. So when we brought our initial budget proposal to this committee for approval, we were looking at an additional $900,000 or so in tax levy. Between some changes related to the counties now doing 2% COLAs and the insurance rates are, more set. And then us really adjusting things, we're looking at an increase of $636,595 in tax levy instead of $900, which is good news, right? At this point, we're looking at approximately a $525,000 projected deficit for 2025, right? It could go up, it could go down. It's based on how our placements turn out, obviously. Our CLTS cost reconciliation. This is a process where we usually get money back, but sometimes if you recall, we don't necessarily get it back before our books close. So it may or may not be booked 25. It may go into 26's prior year revenue. I know this isn't new for some of you, but for some of you, that's new information. And then we're having some issues with WIMCR, which is a reconciliation for some of our clinic Medicaid programs. And depending on how that goes, we could owe money or we could get money. So that's what we're looking at for right now. We have readjusted in particular our children's placements request based on better data that we have about where kids are at. So that went down a little bit. So instead of asking for nearly $530,000 in placements, we're asking for an additional $382,150 in placements. I just want everybody to know that that is my priority funding. In the past, there has been play with those numbers. Yes, we have to pay for it anyway, but this will be our third year in a row that we're running a deficit. And I don't know about everybody else, but I'm tired of running a deficit. And if I'm gonna get my budget cut, not based on my recommendation, then I don't want to hear really the feedback about why we're running a deficit. So I think we really need to get the placements under control, and then do some future planning, to perhaps come up with a contingency fund so that when these things happen, it's not going to be a draw on the general fund and impact the county as a whole. What are some other things that have changed? We are not going to be pursuing our coordinated services teams grant for 2026. We just really have been struggling to figure out how to capture that money. It requires a match. Basically, if we don't have a way to capture the whole $60,000, it's a financial loss for us. So we've decided we're not doing that for 2026. We may reapply in 2027. It's not a all or nothing, but for 2026, it does not make sense. We have chosen to not pursue filling the community support specialist position for 2026 at this time. We have some other things going on in the clinic, especially with our therapist positions that I think are more important to fill. We would still like that position. So at some point in the future, perhaps sometime in 2026 or for the 2027 budget, we will be looking at wanting that position. But that's a little bit on hold right now. And we are going to be doing some work redesigning what our nutrition program looks like. So we've decreased some funding in our nutrition program, which is basically equivalent to 2 part-time dining site facilitators. Our nutrition program looks different than it has. We had that weird thing going on during COVID and we have let things settle. And at this point, it's time to make some changes and really talk about what we want our nutrition program to look like. We've talked about this here before, but we have an ever increasing need in our homebound meal delivery. And those people are our most vulnerable people when we're talking about people who need those services. So we're not, we're not going to take that lightly. We're still going to be offering dining sites, but we're also a very small county that has supported 6 dining sites. And it doesn't really make sense based on attendance and some of those things. And if we don't have a certain number of attendants each time that we have that, again, we have a threshold. And if it doesn't make sense fiscally, we're going to be redoing that. So those are some of the changes that we've made to go from an ask of $900,000 to $636,595. And for those of you that sit on exec and finance are going to be attending that, we will be going through that and some of the other things that we previously talked about in our first meeting where we had budget approval. So I don't know if there are questions, comments. Maybe.
So a couple questions. One is when I was looking at the 2025 year-to-date budget versus actual, there were several expenses that were over 100% already, some over 200%. So I'm wondering if those expenses are reflected in the budget.
So it depends on what it is. We did general adjustments up and down to talk about rates, trends, services, those sorts of things. So I don't know if you have a specific line. It might have been adjusted. It might not have. It might have been a fluke thing where, oh, we got a bill and that's just what we're spending and our trend data still shows whatever. But yeah, as part of our report last time, we did general adjustments. I mean, we went through everything and adjusted up or down expenses and revenues based on what trend data we have.
So then the second question is, you talked about a contingency fund.
Mm-hmm.
So when do you start to fund that?
Well, first, we need to get a handle on actually not having a deficit due to our placements. So a lot of counties choose to do this. I think Ron can speak to this, Jen can speak to this. I recall one of my counterparts, Glenn Stardarelli, who just recently retired in Manitowoc County, but he was their finance guy before he was their director. And so like Manitowoc County had one for years, right? So then we have to talk about how much do we want to put in it and what do we want to cap it at? But the idea is, right, placements are volatile in human services. They're just gonna be. We can't fix that. We're gonna continue to do what we can to provide services in home, to not remove people, children or adults from their homes, but sometimes it just happens, right? And so, and then to try to find some funding sources if possible, mostly in the adult world. So that's what we have to talk about, but we can't even really talk about that like concretely until we level off our placement costs. If we're gonna run a couple $100,000 deficit every year, because we're not properly funding our placements, then it's a moot point.
In other words, Peggy, a couple of years ago, not that many years ago, Mandy was returning, I think, about $800,000.
That was the largest we did, but
About
yes.
$800,000 back to the general fund. So instead of directing that, so she was under budget. So then in taking that 800,000, what we could have done at the time, instead of going to the general fund, would be to put a contingency fund for the next year. So then if there was an overage in that budget, then it would come from the general, from that contingency fund.
Right.
Right.
So yeah, up
I guess
until,
my point is, if we budgeted 900,000, now it's 675 or whatever. Or, you know, whatever,
There's-
over.
Yeah.
That much over, but can't we pad that a little bit? And
I mean, that's your guys'
maybe
call as a
start
board.
working in
That's your
that
guys' call as a
direction,
board. I would
you
like
know?
to see, yeah, I mean, I don't disagree. I mean, Ron's right. So I've been here, on Wednesday, it'll be my 13th year here. And for the first 10 years, we had a surplus every year. The highest was $800,000. The lowest one year was like $963. But generally, you know, decent amounts. So the idea would be, rather than returning all of that to the general fund, we'd keep 100 grand or 200 grand or whatever. Now, most counties, when they do this, do cap it at, you know, $500,000, maybe $1 million or whatever. But the idea is to not have that volatility affect the whole county, right? So now I'm coming in again and we're gonna have at least a $500,000 deficit, probably, right? That impacts the county as a whole versus when I can give money back. Now theoretically, other county departments are giving money back and it's not all being taken out, right? Like it's a little bit of a, but big picture wise. I see what you're saying though. I feel like we're not there yet and we need to properly fund it first and then talk about what do we want to put in a rollover account. That's just, it makes more
But it
sense.
almost feels like you're chasing a ball around, because how are you going to properly fund it when it changes from?
It does change it, but I can tell you that the last couple of years when I've said, we're gonna need this amount of money to fund this for what we think we're gonna fund, and it's been cut, we're not even close. So I will tell you right now, obviously things can always happen and you're right. I don't have a crystal ball. I feel very confident about the numbers that we put in here for placements, adults and children going into 2026. We have a little wiggle room in particular in the children's area where we put in money for unknown, right? Because in the children's world, it's more likely that kids are gonna come to our attention that we know nothing about. It doesn't happen as often in the adult world. I would say that the information that we have, particularly in Dawn's unit about adults placements, is pretty solid. We know who these people are. Some of these people are staying with us. We have some wiggle room for people who come to us, emergency detention, that way. We don't have good data in Jan's unit because we haven't really done it before. The only good thing though in Jan's unit is that if we can get them enrolled into a long-term care program, we're not paying the whole year, right? So we have a little bit more flexibility there with some other funding sources. That's why I feel confident in the numbers that we're requesting. But I see what you're saying. I could be wrong.
Bump it up to 700 or something.
I mean, let's
Oh,
get
yeah.
a little extra.
We've already got a possible 136,000 built in. I mean, if we can hold it to 500,
Oh, no.
and you're
no.
requesting
Right, no, the
636.
The total cost that we have in our budget, this is over and above. We are projected in our budget to spend $1.39 million on placements. This is above what we were asking for. Placements cost us anywhere between $1 million and $1.5 million. This is additional tax levy that we're asking to
Right.
cover the placement cost to get them real. But the total cost is 1.39 million.
And we have to keep in mind our general fund and the health of the general fund, and then being able to fund all of our other programs as well. If we were, let's say, Green Lake County, I would agree with Peggy. I'd say, yeah, put $1 million in there because we can afford to do it. But we are running very lean, and the draw on our general fund, even if it's, $300,000 or $400,000, is gonna hurt our general fund. And then to the point where we have to look at other services then for potential cuts, just to keep our general fund where it needs to be.
And ultimately, board will decide that when they, right, like, I'm telling you what I need for our department. I don't live in a complete vacuum, so I'm aware of what's going on in other departments, but I don't know what those final numbers are gonna look like. If we can afford it, would I love a couple extra $100,000? Absolutely. But right, this is balancing. We don't wanna overinflate either and then come back and be like, oh, you freaked us all out. Instead, we were gonna spend all this money and now you're returning $500,000 either, right? So it's a little bit of a balancing game, and it's just the reality of what we do as a profession. But I get what you're saying, and I appreciate it. I feel like that's being supportive, so I appreciate that.
And it'll be up to the committee, but what I advocate for is if you are under budget, especially in those out-of-home placement costs, whether it's a child or adult.
Right.
You take that and create that rollover, put it into that contingency fund, so it starts to build it up.
And it would be a good conversation. I mean, if we're at the end of 2026 and we're gonna have that, then I think that's a really great conversation for us to have and a really good thing that we consider. I think right now, I'm saying in the future because we don't have that luxury, and I'm not gonna have that luxury at the end of 25, so it's hard to ask. I don't wanna ask, right? There's other departments that have other needs and we all serve people, so.
And that could be part of our fiscal strategic plan, especially for this department, as well, is to put that into the strategic plan. So if there is an overage, or under budget, basically, you do put that into a contingency.
Apparently Damaris has a question wanting to know what the community support specialist role was. That was a position, Damaris, that we created, that we wanted to work in the clinic. Basically to do supportive services through our clients that receive CCS, Comprehensive Community Services, and perhaps CSP. Right now, we contract for that. We had a discussion about if we brought that position in-house, we would probably get a little bit more bang for our buck, less travel time, those sorts of things. Basically, it makes sense to do that. We just have some other things going on in the clinic right now that make it, and with our budget, that make it a little bit, we're gonna put it on the back burner for now. It's gonna come back, so I'm not saying we're getting rid of it, we're gonna put it on this for a little bit. It's for community support specialists. It's basically like a professional mentor in the clinic.
Yeah, that was gonna be my question too, something.
Yeah.
Thank you.
Circling back to the nutrition programs, so can I infer from what you said that perhaps there will be less than 6 meal sites going
There
forward?
perhaps will be less than 6 meal sites. There also won't, like, some of our meal sites are multiple days. So I can tell you right now that we have a couple of sites that are 2 days a week, but they each have one day that they're really have good attendance and another day where we've had to cancel because they haven't had enough people. So those are the kinds of things that we're looking at. I know it sounds really bad, but the thing you guys need to understand is that, right, when we're looking at tax levy, we have a lot of tax levy that goes into our nutrition program and our transportation program. And you know, it's somewhat counterintuitive because they serve our elderly and disabled populations, and our elderly population is only growing, but it's more like shifting where our needs are, right? The last thing I want to do is have a wait list for people who are on homebound meals, right? Because those people don't get out. They can't get out. Our folks that go to the dining sites, they're able to get out and do other things. And so we're really looking at our data for our dining sites to go, you know what? We probably don't need 6 sites. And we probably don't need, or if we don't need all 6 sites, we don't need them to the extent of the days that we're doing now. Right? And some of that has to do with our location, how many people go there. I mean, there's a lot of moving parts to that, right? So we're not just gonna say, we're not offering that, but we're gonna rework what it's looked like. It's been a long time since we've done that with our nutrition program, and then COVID threw us a real loop. And we've talked about this, we thought that our dining site numbers would go back up more substantially than they have. They haven't recovered. We also thought that our home delivered, numbers would go down. They continue to go up. So we basically need to do some data analysis and figure out what's gonna work and try some things and change it up.
And just to follow up to that, is there requirements for getting homebound meals? Like,
Yes, there's a whole eligibility screening tool. We've actually piloted and are using a tool that actually is a risk assessment. So we know our most vulnerable and they rate them. Correct, Jan? Did I say that right? So again, we need to be serving our most vulnerable people first. That's how that works. So yes, there's a whole eligibility screening. You don't just get to say, I don't want to leave my house, or I don't want to drive, or I don't want whatever, I want meals. There are some pretty specific eligibility criteria to be able to qualify. And some can be short term, like, right, you're recovering from surgery or whatever. But many are longer term, right? They don't have the mobility to be able to get out into the community. And we know it's more than just a meal. So those are people that we need to take care of first.
thank you.
Yeah, my only comment is, I would much rather see the sites continue, even if we have to be consolidated a little bit, or where the plan comes from. You know, I'm just thinking of my neck of the county, you know, Packwaukee and River Oxford, so close to each other.
Yep.
And we, and people that go there, I mean, we know people from all those three different communities, so even if you had to consolidate one day a week or something.
We talked about that, Mary, because I said, look at our border. We have all these sites on our very far west. Like, do we need that? They're not that far in between. So those are exactly the things that we're looking at. Who do we have a really good working relationship with? Some places charge us money for rent. While it's not a ton, you know, we're working really well with some other places who provide us better service, who don't charge us at all, right? So there's lots of moving parts into that. I don't really want to get into the weeds, but it's time for us to really do some data analysis and figure out long-term, what can we sustain that's gonna meet our folks' needs for nutrition.
And to me, that's such a better option than just eliminating it completely.
Yeah, we're not eliminating all sites, but you're exactly right. And we have a bunch of sites that are in one, you know, and that might be it. Like, oh, this site isn't necessarily well attended, but there's no other services out there. We might need to do that. These are all factors that Jan and I and Jen and a bunch of people are rolling all kinds of ideas around it. So I can't tell you specifically what that's gonna look like yet, but we know it's time to make some changes.
Any other questions regarding changes? I think you explained everything very well.
We're trying to bring a good package, and
Anything else that you have, Christian?
I don't, I feel like I've done a lot of talking, so somebody else can go for a little bit.
Okay, and then, does anybody have any questions on the vouchers at all? And I believe Mandy, highlights of the financial report.
Yeah, I mean, we provided the financial reports. I know that, again, they're not always the most, right? We have to run them kind of early, that sort of thing, but I think our highlight was Jen and I really talked about our projected deficit and then what we're looking at for 26. So I thought that was kind of the information you guys really wanted to know. If not, we can change it up. Let us know what else you want.
I want to commend Randy and Jim for going back to the budget and really kind of redesigning it with a different perspective. Okay, good job.
Thank you. I mean, I don't know what other departments are bringing. It's not my problem. You know, I mean, we want to play nice in the sandbox, but what they bring to the budget hearings, I don't know. And if we have to go back to the drawing board, we're prepared to go back to the drawing board, but I feel like we've done some pretty good work and
Yeah,
That's where we're at.
I would like to echo what you said, Ron. As long as I've been on this board, and certainly since I've been on this committee and chairing this committee, I think Mandy and her staff have been very, inventive about thinking outside the box and, you know, trying to do a lot of things with very little resources. So, on behalf of myself and this committee, and certainly our citizens that have accessed your services, and thank you.
thank you, Mary. I appreciate that. I'm glad that you included the whole team because it's not a one-woman show here. They get tired of my ideas, I'm sure.
You know, and
Dawn's
you
grinning
know,
at me.
the way the world is right now, any one of us could be one misstep from losing all kinds of services.
Absolutely.
So, I don't care what your situation is, the stock market could crash tomorrow and, you know, whatever. So kudos to you for taking care of the people.
Thank you, and I appreciate that reminder because you're right. And that sometimes what we talk about, we remind ourselves that we are one step away, so.
And having worked in this department, I know we don't always get out things, so. Move on to then the financial unit, Jennifer.
Sure, so, one of the things I just thought I'd briefly cover on, is the, 2024 audit. I know that the county board will be receiving a report on that. One of the newer things that, the auditors have identified that we're working on is our internal controls, not only around submitting our drafting and submitting our monthly state reports in order to get our funds, but also the preparation of that. So a couple of the findings that our department had related to needing to document who prepared the information separately from who submitted the information. So it's something that multiple counties actually across the state are looking at, just how that works. In larger counties, they don't have as much of a challenge because they have more staff and are able to more easily segregate those responsibilities. Here in our department, when the accountant position is vacant, the segregation goes out the door. And so unfortunately, because we had those kind of vacancies in 24, we were not sort of passing their muster, so to speak. But fortunately, there were no concerns around the actual dollar amounts submitted, the claims submitted, the reimbursements, or submitting claims for things that are not allowed. So really, this was solely just from a documentation standpoint. So I have been working on the internal controls and really just thinking, Mandy and I have been talking about that too, as far as how we can do that, and then who would step in place if we had a position vacancy or somebody out or something like that, and actually have it written down and just shore that up. So, you know, as always, auditors give us a great opportunity to help us find things that we could do better, right? So, so that was kind of great, but I just thought I'd provide you a little more context on that so that when you see that, you're not really completely scratching your head and like, what's happening, you know? So yeah, I didn't know if there's any questions about that.
I have a question, not
Yeah.
about the audit, but in general, is your department doing better now that you have help? I mean.
Yeah.
Good question.
And all this other-
Yes. Oh, that's great, Peggy. Great question. Yes, it is. We are actually really enjoying getting our second billing specialist who's really delved into the children's long-term support program billing and the birth to 3 billing. And that has been going really well, I think. Really learning how the team can kind of recalibrate itself, so to speak, on who's kind of doing what and what all the responsibilities are, and where we can really utilize that person to just really ensure that we're on top of managing all the authorizations and the claims related to almost 90 children just within that program alone. And the state continues to make changes. So it has really allowed us to just breathe, and for Jesse and I to not be so anxious around feeling that sort of inadequacy, you might say, on managing that. Yeah. And so our other billing specialist has really been working to get more current on the billing, like more timely billing. Not that we were losing the money, it's just we want to be submitting claims timely. That's ideal, even though the state gives us a year. I mean, like, great to go back and fix things or correct things if we need to, but yeah, so that's definitely getting caught up, and I've really been working with her to get her trained up more on when it comes to WIMCR and things that, quite frankly, it is not sound for me alone to know how to do. But it was not an option to get somebody else trained on it. And so now I've been working to kind of get other folks trained up on things so that there's two of us working on these kind of bigger projects and not just myself. So, yeah, so really going well, was definitely a great solution. Do not regret it. Definitely very appreciative. And I think long-term is going to work very well for the department as we imagined.
Yeah, and then I would just add that I think our person that we hired in the accounting role has been really great. She's actually got to touch the budget spreadsheet, which I know maybe sounds not like a really big thing for some people, but it's a big thing. I was gonna go in and change some numbers for Jen, and then I was like, no, that'll mess it up somewhere else. But Denise got to go in and change stuff. But it was also like, right, as myself and the managers are in it and looking, it was really nice to have, again, that other set of eyes
Yeah.
going over it from a different perspective and catching things and like asking really good questions, like, why do we do that? So I think overall it's been really good. They're all really learning. It's all complicated, but the reality is Jen has a lot of knowledge in her head, which is great, but we have to share that with other people and have other people that know how to do that. And so I would say that we're moving in the right direction. So thanks for asking, because it's a heavy lift, especially this time when there's reports due and we're trying to do budget, and it's been really nice to just be like, nope, they're gonna handle it.
Any other questions on the financial piece? Otherwise, Jen will have moved into the food bank.
Yes, for sure. So, let's see. So the food bank data for September, we actually saw a slight decrease in the number of households being served. It's kind of interesting for Rochelle and I. We don't know why. But we saw 299 households served. We haven't dropped below 300 for a couple of years. Still held at the same percentage of seniors and children being served, which is about 62%, right? And I don't know if there was a glitch in the report, but there wasn't any new households served listed. So I'm not sure if that was truly a 0 for September or if there was a glitch in the report. I didn't get a chance to ask Rochelle this morning about that. Yeah, otherwise that was kind of our service data for September. We're definitely gearing up, as you might have seen, our fundraiser for Thanksgiving meals. Might have seen that in the paper. Please consider submitting a donation. Really makes a difference. It's also just one of our larger fundraising opportunities. And so, yeah, we'll take donations even past the time frame that we're submitting meals. We're really trying to commit to purchasing that number of meals, even if we don't quite raise all the funds, but we really would like to. We raised from PigFest event, we raised $7,612.91. So that's about where we've been at for a few years now on what we've raised. So that was great. We didn't go lower. Obviously, we'd love to go higher. We continue to learn and grow and try to figure out what else we can do. We really tried to push our outreach efforts this year. We were in the Montello's parade. We continued to push Facebook. And so, yeah, we'll keep trying to do that and just raise awareness of the food bank. And then I really want to do a shout out to Lake Arrowhead Campground. Just so thankful for their support and partnership. They're really great to work with. Love working with them, actually. Look forward to it. And really, they're the ones that really allow us to do the PigFest fundraiser. So, and then the other news was that the food bank was closed last week. First time I think it's been closed, can't even be years, but it was closed last week to accommodate the installation of our new walk-in cooler and freezer. And so that was done, that went well. I haven't made it down there yet to see it, but Rochelle and the volunteers are down there working today and then this week really to get everything transferred back into the freezer. We utilized our truck and because the truck has a
Refrigerated trailer.
Yeah. And anyway, so that was great, other than annoying the neighbors, I heard. I did get that feedback. But
Kicked on and off.
yeah, I did get that. They didn't like that. But other than that, it definitely used very little fuel. We didn't know how much fuel it would use to do that. And it was very little fuel. So we were very happy about that. But everything is going to get back to normal this week and we'll be ready to serve people starting tomorrow. So anyway, that's what I
Any questions on anything? I just want to say thank you for the shout out to Lake Arrowhead because I don't know how I got on there or their feed got in my Facebook because I'm not a camper. Never wanted to be a
No,
camper.
but
But anyway, it pops up in my feed.
The food
and I
bank's
can
baked
say that they did their part in advertising
Oh.
that stream as well, so.
yes,
That was an added plus on, for you that they did that, so.
they do, and they have a dedicated Facebook page just to that barbecue competition. And then that's a huge, they have that going and the campground Facebook thing, and then, of course, we're sharing it. But yeah, a lot of traffic, lots of traffic, yeah. Did you have a question, Peggy?
Yeah, I was just wondering, did the freezer installation come in on budget?
I have no idea yet. I don't know yet. Yeah, Paul Van Treek was coordinating that. I'm assuming it did because there was no complications I heard of, right? There was no delays in anything. So I didn't hear about any complications. Rochelle was keeping me posted. So I think it did. It very much, I'm not expecting an issue.
We'll follow up
But
and let you guys know.
and
Good
we'll-
question, but yeah, I didn't.
yeah, and that'll show up at the next meeting too. And you're also gonna see the voucher being paid for. So yeah,
Officially, it's a brief for the.
Yes,
it's what then?
It's a reefer unit.
It's a reefer. Yes,
It's a
I know.
reefer. The refrigerated
reefer
trailer, but
unit.
if we said that, people might not know what that is.
I understand that, but
I know.
I figured we should let. you-
Yeah, it was kind of funny because, right, we put it here so that we could watch it more, and
And
then.
then fuel it up when we
So
need
people,
it.
so people were like, what's the food bank truck doing here? And then, right, like it kicks on and off the noise. So I'm assuming that was the complaint from the
I
neighbors,
did.
right, when it has to cool our food down. So yeah, people, it was kind of a topic of conversation.
He was
People were
giving us
like,
more of a
"What?"
hard time because I know the neighbors, so he was giving us more grief, but I know, knowing him, there was still an underlying, I don't like it.
All right, any other questions for them? Thanks a lot. Children and Family Service Unit, Jesse?
You skipped Dawn.
Skipped a couple.
And you skipped
Oh.
Annette, but she's on vacation. That's okay.
Oh,
We always shake up the order, Mary, so,
I skipped two people.
I know.
Yeah, economic support and child support. I know that's not here. but
Yeah, and that's on here.
should
She didn't have an update ready. I do know that, so in our child support program, right, our program fiscal year ends end of September. So when I talked to Melissa, one of our child support people, she said they're waiting to make sure that they met all of those. They want to meet all 4 of the federal data qualifications. So she was hopeful, but we haven't gotten official word yet. So
We'll have some news for next.
yes, so hopefully we have really good news. That was their goal. It was a good goal. It was a big goal, but.
Okay, I do have new glasses, so I'm not seeing this. in the video.
I'm gonna take it personally, Mary.
I know that. Clinical service unit then, Dawn.
So, crisis calls, we had 180 crisis calls so far to date, so, that means that we're still on track to be down crisis calls this year, which is. good
Cross your
news.
fingers.
We've had 18 emergency detentions as of this weekend. That puts us at about the same level as last year. So we were, the average for the last 3 years was 26. So we're on track for about 24 for 2025. Our wait list for services, so we have 19 individuals waiting for outpatient counseling. Some folks have been on the wait list for 90 days. I anticipate that will only get longer until our vacancy is filled. And then we currently have 8 individuals waiting for our CCS program, and some have been on the list for about 14 weeks. And that's pretty unusual for us to have a wait list for CCS. So that definitely was impacted by the fact that we had that vacancy and we're not able to open new cases until we got the position filled. So changes I wanted to talk about. Some of you may have heard about Tellurian Detox closing. So there was a story on Channel 15 News out of Madison last week or 2 weeks ago, probably 2 weeks ago. that Tellurian was gonna close their detox facility. Marquette County does use, Tellurian's detox facility for, not very often do law enforcement take folks there for detox, but periodically. I would say maybe 6 or 7 a year. So initially, we were thinking we were not gonna have a detox option. I have since spoken with the folks from Tellurian. I've also spoken with my counterpart in Dane County about what they're planning to do. Because the big reason that detox was closing, they were running a deficit. They were requesting an increased rate from Dane County, and Dane County was not able or willing to agree to a higher rate. So that's why they were closing, detox. They are planning to open, so they are closing their current detox unit. They are working with DQA to certify a different unit, a smaller unit, and continue to provide detox on a smaller scale. Dane County is actually looking for a provider to operate what they're calling voluntary detox. So currently Tellurian provides medical services. So the certification that they have requires them to have a medical director, so a physician that oversees their services. They have RNs on staff. So if people come in and are detoxing and are going through withdrawal, they can provide comfort meds. They can do some basic kind of nursing care. That seems to be the expensive part of detox. So the facility that Dane County is going to be contracting with somebody for, they haven't put their RFP out yet, will not have any kind of medical services. It will simply be a supervised, somebody can go there and detox from substances. So it's not someplace that the statutes allow our law enforcement to take people. So yeah, so that was a concern. We did have a conversation with the Sheriff's Department staff about that last week or the week before. Was it last week? Yeah. Sometime in the recent past. And so I think we were more concerned at that point, but since learning that Tellurian does intend to have a facility just on a smaller scale, I think that's helpful. But I am also planning to reach out to St. Agnes Hospital in Fond du Lac because they do some detox through their hospital facility. So trying to make sure that we have some options for the few occasions that we do need it. And then other information, I just wanted to share with you that last week, Wisconsin released their 2025 suicide prevention plan. So I thought you might be interested in just learning a little bit about kind of suicide rates in Wisconsin. So the suicide rate in Wisconsin increased 15% from 2014 to 2023. Now that's similar across, so nothing that's happening in Wisconsin is unique to Wisconsin. It's pretty much the same across the country, but the data, the numbers that I have are specifically for Wisconsin. Suicide is the 8th leading cause of death for all Wisconsin residents and the 2nd leading cause of death for youth between the ages of 5 to 25. Rural county residents have a higher rate of suicide, being 17 to every 100,000, 17 suicide deaths per 100,000 residents versus 14.2 for non-rural areas. Veteran suicide rate is 54.9. So think about that. It's like 3 times the average rate. Suicide rate amongst males is 3 times greater than females, and males account for 80% of Wisconsin suicides. So that can be, I think we hear a lot about like teenage girls, right? And so sometimes we have this misperception that that's who is attempting and dying by suicide, but it's actually middle-aged men that are more at risk for death by suicide. So suicide rates are highest for people in the ages of 45 to 54. Over half of suicides involve firearms, followed by suffocation, poisoning, and other means. And veterans are more likely to use firearms than any of the other means. And then the occupations with the highest suicides rates: construction, farming, personal care workers, and maintenance or repair. So that's information that's important for us to think about when we're looking at like our strategies for how are we gonna do suicide prevention, who are the populations that we need to target. You know, the fact that firearms are used in half of the suicides. What does that say to us about like means safety and what kind of efforts we might want to put into some education around being safe with firearms? And I know that firearms can be a hot topic for people because everybody, you know, people feel strongly about their right to bear arms. But we also need to, most of the time, people want to bear arms to be safe from being a victim of crime, but it can also raise the risk of safety in your household to other people. So it's finding that balance, right? Like, how do we do it and be safe? So that's the information that I had for you.
Will all the data show up in the minutes, or is that accessible somewhere? I was trying to jot some of that down.
I can send you the suicide prevention plan, Wisconsin suicide prevention plan, or the link to it. Yeah.
September was suicide prevention.
September was suicide prevention month. Yeah.
So a lot of the statistics you mentioned, it's surprising with some of the articles I've read years or whatever, but I keep seeing more and more reports or news articles about the increase in suicides in farmers. Do we have any statistic? I know you said like veterans are a certain percentage. Was there anything regarding the percentage of farmers?
I'm not remembering anything from this particular report. Remember that we are providing COMET training. So this year we did use some of our grant funds to partner with UW Extension to have a couple of, one UW Extension staff and 2 clinic staff have been trained in providing the COMET, which is a suicide prevention specifically for rural areas. It was developed out of the University of Colorado and has some evidence base behind it. So we provided a training earlier in the year in June. We're planning to provide another one come mid-November. So in a few weeks, you'll start seeing some of our marketing around trying to get the word out about that training. But I can look specifically for that
I was just
information.
curious if you read across anything regarding that.
I'm sure it's in the COMET stuff.
Was that, I think it was number 2, like career.
Farming.
Yeah.
Yep.
Yeah.
Construction was the highest, and then farming.
So I agree. I think it's important, especially for our area where we really rely on that. I know that I actually attended recently. Our behavioral health training partnership does these short 2-hour trainings. And they're doing it about suicide prevention with different populations. And I actually attended an agricultural worker one, and it was, I can't say it was all new, but it was really eye-opening and it was really good, and it really made me think about that. There's one coming up about veterans, there's one coming up about holidays, those sorts of things. What was really good, I thought, about the training that I attended is that the woman who did the training is actually out of the state of Minnesota, but she comes from a generational family farm and really talks about that. And then she's a trained therapist, and so her area of expertise is specifically working with agricultural workers. And I thought, for me, that was just really impactful because I could see that if I'm a person in that position and I'm looking for help, like she gets it. It's not just like this therapist and like, what do you know about ag working? And she's like a 5th generation large farm family, and just there's even a snippet of a podcast of her talking to her dad about it. And it was really powerful because I just felt like how impactful she could be. And so she goes around the country and does these sorts of things, and she was just really good.
Yeah, personal experience.
Definitely, because I agree, I'd be like, well, what do you know about it? What do you know about all, your late hours that you work, Ken, and all the, like, just the whole, and just the pressures and just, I mean, it was really good, really well done, she was really great.
Any questions about anyone? Thank you for all that information.
Mhm.
Our next CST CCS coordinating committee would be October 16th, which is next week, I believe already.
Yep.
At 4 o'clock. Now we'll go to Jesse, Children's and Families.
That's my turn. Hello, everyone. I thought I would give you an update as usual in our out-of-home care placements. I really thought I was going to give you some great news about not so many kiddos being in out-of-home care, but unfortunately, we have a total of 4. One that youth actually ended up going into residential care, where another one was exiting residential care. So there is a slight overlap. And then we had 2 that go back or go into relative care as well. So that's a little ebb and flowing again, something that I was not expecting. I thought maybe we could do a little more in-home safety planning, but unfortunately a situation arose that we could not do that. So that's that situation. The other thing I just want to kind of give you a heads up on that is out of our norm in my unit is the Birch 3 program. If you remember, and I should have never told you guys about this, a couple months ago, I said, oh yeah, Birch 3 program is maintaining a fairly workable approach, maintaining active members. Well, now we went through the sky, like through the roof. Within the past month, we've had 12 referrals. 9 of them will be coming into the program, so we are going to have a large increase of kids eligible for Birch 3 programming. With that, it's also our contracted service, CISA 5. We contracted them to provide the physical therapy, speech therapy, occupational and special education that's required, and increased costs. So not quite certain as to why that happened. We don't know, but we were very shocked that it was this drastic increase. 12 in a matter of like 5 weeks is huge for our small community. And having most of them be enrolled is also a huge shock as well. There is some indication that about half of those kiddos that are enrolled will also be eligible for Children's Long-Term Support Waiver. So if you remember, I talk a lot about CLTS and how our kids are young, and it's like until they're like 22 years of age, they stay enrolled in our program in CLTS. So there will be some increase for that.
Yeah, and as you reminded your community, I know some of you know this, but there is no wait list for those programs. We have to serve those kids.
And both the CLTS and Birch 3
both programs.
pretty much none of my programs in my unit wait lists. As they come, we have to service them.
And where the 3 referrals can come from doctors usually.
They are typically doctors, child care providers, parents that are concerned. Most of this group of referrals actually have come from parents, which is interesting. Like they've gone to their checkups and the doctor's like, hey, why don't you reach out to your local Birch 3? And so the parents are following through and reaching out to us. Whereas usually it's the doctor's making the referrals, so not quite certain as to why that transition. But
I don't know, but in a way, it's the same way if the doctor's, talking to the parent about it, and the parent is being proactive.
correct. I'm pleased with that, to be honest with you. I think that when parents are calling and requesting the service, I think we have a lot more follow through with them versus having like a doctor or childcare, what have you, or referral.
So how many do we have totally enrolled in the program?
As of right now, 16, and on average, we have about 10. So we're finding. I think the last time that we were high was when Jan still supervised the program, which was how long ago?
Right.
It's a long time ago. Yeah. It's been a while.
We've been 20-something.
Yeah, I
26.
think so. I was just gonna say, I think
No,
that
I
price
remember-
I ever remember was like 26.
Yeah.
Yeah,
Yeah.
it's been 10 years. When I started, Jan supervised the program, so.
Yeah, so there's definitely
Ton of
that
items.
increase, and so I think when we're dealing with that, our virtual 3 coordinator, it also carries the sales gas caseload as well. So there's some crossover with that as well. So the balancing act as well, and as we talked about here with the budget amounts, we're very lean through, and we just do what we have to do.
Exactly. You have to take care of those kiddos. Any other questions for, is that all you had, Jesse? I'm
Yes,
sorry.
That's it.
Any questions of Jesse? Barbara, did you have one?
So just remind us, the first of 3, these are children that are developing as a.
That's correct. They have to have a 25% below their developmental stage.
So this could be physical or emotional.
Yep. Physical, emotional, speech is usually the primary focus. I think a lot of our kids qualify under speech. Otherwise, they're like walkers, when they're 15, 18 months old and they're still not walking, we tend to get those referrals, the speech. Yeah, big gross motor skills are, I would say, would be our second category that we tend to see a lot of kids eligible.
All right, and no other questions? Thanks, Jesse. Aging and Disability Services Unit, Jan?
Yeah. Okay. Just a couple updates on my part. A reminder that, last month I handed out the newsletter. To get one, we still have copies left. Let me know, I'll get you one. Otherwise, check that out for info. Open enrollment for Medicare starts October 15th. Just a reminder for everyone, we do have an elder benefits specialist. She is taking appointments and accepting them on her calendar. I will say we already have her first 2 weeks filled up. And it does get to a point where she is filled up all the way through December 7th. So at some point then she's packed and then you have to go to the hotline and so that line on the telephone for a while. So schedule those appointments. Caregiver nominations, in the newsletter, we do our caregiver appreciation every year annually for Marquette County. The nomination form is in the newsletter. I believe it's also on our website or the link to it anyway. So if you know a caregiver, which we all do know caregivers, whether or not they admittedly openly or not, send out the nomination form if you think you know an exceptional caregiver and the reason why. So we appreciate it. Out of home placements for us, we're kind of holding at around that 30 mark. We do have some that are in the court process, but right now we have about 30. As of October 1st, we're down to paying for 1. Let's hope that it stays that level or diminishes pretty soon. I do believe that we'll be paying for that one for at least a handful of months annually. Going forward, so let's hope that it stays at that. Our ADRC telephone calls and website information, our numbers are about the same. Phone calls, we're down a little bit from some of the other months at about 76 individuals. And then the website, we're actually up a little bit at about 634 individuals. The thing that was interesting for me with the website is 2 different categories reached the top of the interest list this month that haven't hit our interest list at all this year yet. So that is fuel and utilities and financial assistance. Both of those have not been in the top 5 all year, and this past month, both of them. So that's kind of what people are seeking out the website. Update on transportation coordinating committee. We will have The next meeting will be December 4th. ADRC Advisory Committee, then the next meeting for that one will be November 6th. And Transportation Coordinating Committee, basically, we, at our last meeting, what we basically talked about our application for 8521, which is our operating grant, that is due into DOT by the beginning of December. So that's why we're having a December 4th meeting. December 6th, I think, is when the applications actually due. So we have a draft that through, we'll have a public hearing, and then the coordinating committee. That was kind of a hard discussion last time. Yeah, but anybody else can chime in with updates if we have them as well.
Is that it?
That's it.
Any
Unless
questions
people have
of Jan? Thanks, Jan. Upcoming events, issues for discussion only. I'd just like to let the committee know that with the government shutdown going on, all weatherization services that CAP provides, which is Marquette County residents use the weatherization program a lot. And with the government shutdown, that has stopped. And in the new federal budget, we are very concerned that the feds may not fund that program. That program, you know, supplies new furnaces for elderly or low-income people that qualify, windows, you know, insulation, that kind of thing. So it's a very important program. It's highly utilized in this county as well as across CAP's whole 6-county consortium. So that is a concern that we are very, very worried about. CAP also runs the Head Start program in our county. And we were told that the Head Start funding more than likely will remain in the federal budget, but that there will be no increase. So the good news is it doesn't appear that that funding is going to get cut, but the bad news is then that no new children probably will be able to come into the program unless, you know, the enrollment is down or a spot opens up. And that's a very, very good program for children. We just took a tour, our last meeting of the Head Start facility in Stevens Point, as well as the Child Care Center that CAP runs up there. And it's just phenomenal. It just blew me away. So if any of you have any desire to write to your representatives, please do so. These are programs that directly hurt people. Anything else anybody has under that agenda item?
Mary, I can just share. So as you were talking, I looked up the suicide rate for farmers and
Okay.
it is 52 per 100,000.
52 people per 100,000? That's significant, I think. Thank you, Dawn.
Yep.
All right, if there's nothing else under agenda item 7, our next meeting date and time would be, our first Monday is November the 3rd. I don't know what other committees' schedules look like, so do we want to keep our 1 o'clock time and then everybody else work around us? Let's do that. Let's do that.
We can do that. I think it
Let's-
would be helpful, right?
let's-
Because county board is the 12th that.
Yes. Yes.
Enough to go for us.
Well, let's schedule our next meeting for November the 3rd, which is the first Monday at 1 o'clock. And as the other committees come through, if we have to adjust, we will, but we've adjusted for other committees many times, so maybe they can adjust for us in November. But we'll talk about it, but put that on your calendar. And
I have Kathy's email now, so.
there you go.
And change it on the
Yep.
Cause I had 1 o'clock written down and I thought,
Nope. I know.
change it to 10.
Instead, the worst part is 3 of us look at that and we found other errors and none of us caught that one, so my apologies. I posted it at 1 too, so.
At least you know I read it, right? All right, if there's nothing else for the good of the cause, thank you all for coming, and the agenda having been completed, I will adjourn today's meeting.